Picture this. You twist your ankle, the clinician says, "Let's get imaging," and hands you a form, and you have no idea what that will actually tell you. I'm Jess. I'm a family nurse practitioner and legal nurse consultant. Welcome. I'll walk you through what those tests really show and what to ask before you agree. Quick baseline. Imaging is just different ways to light up the body so we can see what's going on under the skin. X-rays and CTs use ionizing radiation. Think of a beam making a shadow picture. Dense things like bone show up white. Air shows up dark. So if you twisted your ankle, that difference matters. A bone break shows on X-ray, but a torn ligament usually does not. MRI uses strong magnets and radio waves to image soft tissues, things like ligaments, tendons, and the spinal cord, and there's no ionizing radiation involved. Ultrasound uses sound echoes to build a moving image in real time, great for watching blood flow, a baby during pregnancy, or guiding a needle. Let's take the tests one at a time, starting with the simplest, X-ray. It's fast, cheap, and excellent for bones and some chest problems. That's why it's the first step for suspected fractures and many lung issues. X-rays don't show soft tissues well, so if pain persists after a normal X-ray and you still can't bear weight, you follow up. That's where clinical context matters. CT, computed tomography, is basically many X-rays taken from different angles and combined. It gives a lot more detail and is very fast, which is why emergency teams use it for trauma, internal bleeding, and complex fractures. The big trade-off with CT is higher radiation and often the use of iodinated contrast to make vessels and organs stand out. MRI gives the best soft tissue detail. Brains, spinal cord, ligaments, and many joint problems. It takes longer, can be noisy, and some people find the scanner claustrophobic. Ultrasound is safe and immediate, no radiation, but it depends on the operator and can be limited in people with higher body mass or by bowel baths for some abdominal views. A quick real-world example. I once saw a patient with worsening flank pain. The initial ultrasound looked normal, but because pain and labs didn't add up, we did a CT. It found a small obstructing kidney stone with early infection. That CT changed everything. Prompt treatment prevented kidney damage. Now, let's clear up contrast concerns. For CT, we most often use iodinated contrast injected into a vein. For MRI, we commonly use gadolinium-based agents. Most people tolerate them fine, but allergies and kidney function are important considerations.
If you've had a prior severe reaction, tell the team. If you have known kidney disease, your clinician will usually check kidney function first and may choose a different test or special protocols.
Radiation numbers help make this real. For scale, a standard chest X-ray is about 0.1 millisieverts. A typical abdominal or pelvic CT is roughly 6 to 10 millisieverts, and average background radiation in the U.S. is about 3 millisieverts per year. So an abdominal CT can be like 2 to 3 years of background radiation. Sounds big, but the important question is whether that scan is likely to find something that changes immediate care, like stopping internal bleeding or identifying an obstructed, infected kidney. Pregnancy comes up a lot. If you're pregnant or might be, tell your clinician. We usually avoid ionizing radiation when possible. Use ultrasound first and consider MRI without contrast if more detail is needed. But in life-threatening situations, a CT may be necessary. Okay, practical language you can use. Say these short lines exactly if you want to be clear and direct. What exactly will this scan show, and how will it change my care? Is there an option that avoids radiation, like ultrasound or MRI, that would give similar information? Will you use contrast? If so, what are the risks and how are they minimized for someone like me? A couple of red flags to watch for. If a radiology report mentions an incidental nodule without saying what to do next, ask for timing and follow-up. If you have symptoms after contrast, rash, trouble breathing, or decreased urine output, seek care immediately. I know it's a lot, so let me leave you with 3 takeaways you can use right now. First, ask the purpose. Before you agree, ask what the test is trying to show and how the result will change your care. Second, ask about alternatives. If ultrasound or MRI can answer the question without radiation, that may be a safer first step. Third, disclose important history, previous contrast reactions, kidney disease, and pregnancy matter. Make sure the team knows so they can tailor the safest approach. If you walk into your next appointment with those 3 questions and a readiness to ask for plain language answers, you'll be better positioned to get the right test at the right time. Thank you for listening. If today's episode helped clarify imaging decisions or gave you language to advocate for safer care, that's exactly why I do this show. I'm Jess, a family nurse practitioner and legal nurse consultant. You can learn more or schedule a consultation at faqbynursejessconsulting.com. If you found this episode useful, please share it, subscribe, and leave a review so this education reaches more people. Until next time, stay informed, stay compassionate, and always put safety first.